Hi everyone, welcome back to my YouTube channel and today we are going to talk about pharynx anatomy. So let's start the topic with introduction. Pharynx is a fibromuscular tube that forms a part of digestive and respiratory system, acting as a passage for both air and food. It extends from the base of skull to the level of six cervical vertebrae, where it is continuous as the esophagus. It is divided into three regions: nasopharynx, oropharynx, and laryngopharynx. Laryngopharynx is also called as hypopharynx because it is the lower part of pharynx. Now let's talk about extent and dimensions of pharynx. Superiorly, this pharynx is attached to the base of skull. Inferiorly, pharynx continues with the esophagus at the level of C6 and its length is about 12 to 14 cm in adults. Its shape is funnel shaped. It is widest at the top and narrowest at the lower end. Division of pharynx. It has parts that include nasopharynx, oropharynx, and laryngopharynx. All of these parts you can see in the diagram. So first part of pharynx is nasopharynx, or first division is nasopharynx, that is located posterior to the nasal cavity and above the soft palate. This is lined by respiratory epithelium, that is ciliated pseudostratified columnar epithelium. The feature of nasopharynx include pharyngeal tonsils that are present here. Opening of auditory tube or opening of eustachian tube is also there, and pharyngeal recess behind the opening of the tube is also there in the nasopharynx. Next division of pharynx is oropharynx, that is located posterior to oral cavity and between the soft palate and epiglottis. This area of pharynx is lined by stratified squamous epithelium that is non-keratinized, and features of oropharynx include palatine tonsils in the tonsillar fossa, palatoglossal and palatopharyngeal arches, and passage for food and air is also there. The next part of pharynx is laryngopharynx, that is also called as hypopharynx. It is located posterior to larynx and extends from the epiglottis to lower border of cricoid cartilage. It is lined by stratified squamous epithelium. Its features include pyriform fossa that is important for endoscopy and as there may be foreign body enlargement. Second feature that is important of laryngopharynx is that it leads to esophagus. Now let's talk about wall structure of pharynx. Wall structure of pharynx from inside to outside include mucosa, that is the respiratory epithelium in nasopharynx. It is stratified epithelium in stratified squamous epithelium in oropharynx and laryngopharynx. Second wall of pharynx from inside to outside is submucosa. So first we have is mucosa, then outer wall of mucosa is submucosa, that is thick connective tissue, that is layer forming the pharyngeo-basilar fascia that attach the pharynx to the skull base. Next wall of pharynx is muscle layer that includes outer circular layer and inner longitudinal layer. Outer circular layer muscles include constrictor muscles that may be superior constrictor muscles, middle constrictor muscles, and inferior constrictor muscles, while inner longitudinal muscles include stylopharyngeus muscle, salpingopharyngeus muscle, and palatopharyngeus muscle. So outermost layer of the pharynx after the muscle layer is the buccopharyngeal fascia. It is the outermost connective tissue layer that covers the pharynx and it is continuous with the fascia of buccinator muscle. Now let's talk about muscles of pharynx. They include constrictor muscles that are also called as outer circular muscle. It includes these constrictor muscles include superior constrictor muscles that narrow nasopharyngeal wall, middle constrictor muscle that narrows oropharynx, and inferior constrictor muscle that function is to narrow laryngopharynx, and they also form cricopharyngeal sphincter. Then the other group of muscles of pharynx is longitudinal muscle that is in the inner layer, and they include stylopharyngeus that elevate pharynx and it is supplied by glossopharyngeal nerve. Second longitudinal muscle we have is palatopharyngeus that function is to elevate pharynx and soft palate. Third longitudinal muscle we have is salpingopharyngeus muscle that open auditory tube and elevate pharynx. Now let's talk about nerve supply of pharynx. First, a nerve supply includes motor innervation As all muscles in the pharynx are supplied by vagus nerve through pharyngeal plexus, except the stylopharyngeus muscle that is supplied by glossopharyngeal nerve, that is the ninth cranial nerve. Then we have is the sensory innervation in the pharynx, that is in the nasopharynx, that is by maxillary nerve. In oropharynx it is by glossopharyngeal nerve, and in laryngopharynx it is by internal branch of superior laryngeal nerve. Now let's talk about blood supply of nasopharynx. Blood supply include arterial supply and venous drainage. Arterial supply of nasopharynx is by the branches of external carotid artery, and these branches of external carotid artery include ascending pharyngeal artery, facial artery, lingual artery, and maxillary artery. While venous drainage of pharynx include pharyngeal venous plexus that eventually drain into internal jugular vein. Now let's talk about lymphatic drainage of the pharynx. Lymphatic drainage of pharynx is in the retropharyngeal nodes, in deep cervical nodes, and in the jugular-digastric nodes. Talking about functions of pharynx, it includes passage for air and food. The second function of pharynx is that it assists in swallowing. Third function is that it is resonating chamber for speech. Fourth function is that it houses important lymphatic tissue like Waldeer's ring for immunity. And fifth function is that this pharynx equalizes pressure through auditory tube. Now let's talk about clinical significance of pharynx. First significance is pharyngitis, as that is the inflammation of pharyngeal mucosa, and it is common in infections. Second clinical significance is adenoid hypertrophy, that is enlarged pharyngeal tonsils that can cause nasal obstruction. Third significance is tonsillitis, that is inflammation of palatine tonsils, and they may spread to pharyngeal spaces. The infection or the inflammation may spread to pharyngeal spaces. Fourth significance is retropharyngeal abscess, that is infection in retropharyngeal space, that is risk for airway obstruction. Fifth function significance of the pharynx is foreign body enlargement, that is common in the area of piriform fossa. Sixth clinical significance of pharynx is pharyngeal pouch, that is also called as Zenker's diverticulum, that is outpouching at cricopharyngeus level that can cause dysphagia. Now let's talk about conclusion of this lecture video. Pharynx is a crucial anatomical structure that functions as a shared pathway for respiration and digestion. Its complex muscular, facial, and neural organization allow coordinated actions like swallowing, breathing, and phonation. Detailed understanding is vital for clinical fields like ENT, dentistry, gastroenterology, and anesthesiology. And this was all about pharynx. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.